my name is Antoni Colom, and I would like to thank the organization for the opportunity to present the results of this work on Mediterranean built environment and weather as a modulator factor on physical activity, a cross-sectional study. This will be the index of the presentation. So, why should we focus on physical activity? After smoking, physical inactivity is the second leading modifiable risk factor for chronic disease. As seen on this map, we can visualize the gains in life expectancy with the elimination of physical inactivity. And why study environment? A wide range of environmental factors have been related to active aging. Here, we can see the ecological model of the 4 domains of physical activity that have been proposed by Salis et al., expressing how the policy environment, the physical environment, and the sociocultural environment can influence on these domains. Taking this into consideration, in Europe, only a few studies have been explored the impact of weather conditions on objectively measured physical activity in older adults. A closer look into these studies reveals that all of them are being carried out in Northern Europe, leaving out our Mediterranean region, under the idea that when promoting physical activity practice, it's important to consider the plausible environmental determinants that may affect this practice. For this study, we aim to explore the cross-sectional association of access to public open spaces on objectively measured physical activity and the weather conditions interaction on this association in other adult participants from the PREDIMED-Plus study in Baleares. Also, we haven't found previous studies on the joint interaction of both factors. So here we can see the inclusion criteria of the PREDIMED-Plus field trial population. We are focusing on the Balearic Island Recruitment Center, one of the 23 recruitment centers participating in the PREDIMED-Plus trial located in the Western Mediterranean Sea. At this center, 335 participants were enrolled from the primary care facilities of the city of Palma. After exclusions, a final sample size of 280 participants were considered for the analysis. So, these participants at the baseline visit were asked to wear an accelerometer in order to obtain the cumulative minutes per day of moderate to vigorous physical activity. The location of each participant residence reported at baseline was geocoded. That allows us, for each participant resident location, apply a 1 kilometer network walkable buffer. Then, we compute the number and the area into the buffer for each public open space, and also the proximity for each of those. On the other hand, means measurement of precipitation data was collected during the accelerometer wearing period. That was obtained for each participant from the closest Euclidean distance of the nearest participant residence weather station. This table shows the descriptive characteristics of those 218 participants with at least 4 valid days of physical activity data. This other table shows the association between exposure to public open spaces and physical activity adjusted by individual level coverage, gender, educational level, and self-related health. Only a positive significant association was observed between distance of healthy routes in a 1 kilometer buffer and physical activity. Increments of a 1 kilometer of healthy routes in a 1 kilometer buffer were associated with an increase of 1 minute per day of physical activity. Then we tested the interaction between each public open space and training during the accelerometer weighing period on physical activity. The only significant interaction was observed between distance of healthy routes in the buffer and physical activity. Then we analyzed the association between distance of healthy routes in the buffer and physical activity on non-training periods and training periods separately. For non-training periods, increments of 1 kilometer of healthy routes in 1 kilometer buffer were associated with an increase of 2 minutes per day of physical activity. However, during training periods, non-significant association was found between healthy routes in the buffer and physical activity. So now we are working on the question, what about the environment in an intensive lifestyle intervention? Then, when I started working as a dietitian in the field work of PREDIMED-Plus study, I saw this map, and I was thinking, well, maybe I can improve better maps. In that time, I didn't realize the difficulties of that. That map was used to express the idea that the Mediterranean diet is based on the dietary pattern found in olive-growing areas of the Mediterranean basin, and low cardiovascular disease risk and longevity has often been associated to the Mediterranean lifestyle, but without taking into account intrinsic factors such as their surrounding environment. PREDIMED-Plus is an ongoing field trial with an intensive intervention on the lifestyle, comparing the Mediterranean diet to an intensive lifestyle intervention with a primary endpoints of cardiovascular disease incidence and mortality. The intensive lifestyle intervention consists in an energy-restricted Mediterranean diet, plus physical activity, plus behavioral therapy with the objective of weight loss and long-term maintenance. Also, until now, we have been working on only one recruitment center of the study, so seems to be logical that the future work should focus on a larger sample size, including the 22 other recruitment centers, integrating greater heterogeneity of environments. And finally, I'm a dietitian, so I like to move on to the study of the food environment. PREDIMED-Plus, as a multi-center randomized trial, presents an excellent opportunity for future urban environmental studies. Finally, I would like to thank my coworkers, especially my advisors, Dora Romaguera and Miquel Fiol. And if you have any question, I will do my best to answer them. Thank you.